Hello everyone, good afternoon. How are all of you today? I hope that everyone is in the best of health. Okay, we are going to be talking about backache today. So we've got with us the physiotherapist from Columbia Asia Hospital, Tebrau, Miss Nurul, Nabilah, Anuar, Basah. Okay, at some point or other, adults experience back pain. So perhaps this is due to incorrect body mechanics when lifting something heavy. It could also be due to bad posture, but let's not take my word for it. Let's just ask an expert regarding this. So Ms. Nurul Ain, as an expert in physical therapy, she will share her expert tips on how to care for your back with simple and basic exercises. Kan? Apa
Okay,
ni Ain boleh?
boleh.
Okay, all right. Now, before we
Okay,
start off, tell us a little bit about back pain, maybe a short introduction. Silakan.
good afternoon everyone. So actually back pain is a very common cases that we saw as a physiotherapist nowadays. And then what you did every day at early stage is very important because it will affect your future. Okay, let's say if you're not practicing the proper body techniques and then very bad posture, so you won't feel the result in short term, but you will have it in the long term. Okay?
Okay, okay. So maknanya like if you've got back pain, so you really
Yes.
have to know how to handle yourself when you move, how to angkat dengan cara yang betul and
Betul.
all that. So it doesn't
Yes,
affect you in
betul.
the long term. So if you ignore it,
Mm.
it gets worse, like anything
Yeah,
else
it
lah.
will getting worse. It will
Okay,
getting worse
alright.
because it will affect your nerve and then it will
Mm,
compress your back. So
mm,
you will
mm.
have very severe
I see.
problem
Okay.
later.
In your experience di Columbia Asia Hospital Tebrau, so far the patients that you
Yes.
have been seeing to, when they come with back pain, what are the usual causes for them lah personally that you have seen?
Okay, personally I saw patient with back pain if
Mm.
after fall and
Mm.
then bad posture, maybe
Mm-mm.
prolonged sitting, prolonged
Yeah,
standing during working,
yeah.
and
Mm.
then twisted movement during working also I got see before, and then osteoporosis fracture. This one
I
maybe
see.
because once you get age, right, so the
Mm,
bones
yeah,
all
correct.
become porous and brittle. Okay.
Yeah, I think we're somewhat familiar with osteo and what comes with osteo. But tadi what you said was quite
Yes.
interesting about work causes,
Yeah, work
twisting during
causes.
work or something like that kan. So can you
Yes.
explain a little bit what are the things that we are doing wrong when we are at work, we're looking at the laptop.
Hmm?
So what are the things that we can that can damage our back
Okay.
at the
Actually,
office?
if you're working in office work,
Mm.
we have to sit in a proper position. Okay, let's say
Okay.
you have to put cushion or back support over
Oh,
your back. So your back won't curve. It will in straight position, neutral position.
okay.
So
Which part of the back tu?
your
Kat
hip
bawah sekali ke atau kat tengah-tengah?
dekat bawah. And
Kat
then
bawah sekali. Okay. So,
sekarang pun ada juga yang jual back support yang dia support
oh, I
you punya
see.
belakang dari atas sampai bawah.
Oh,
So
right.
and
Okay. So
then
you recommend using that lah.
yes, using that, and then you
Mm-mm.
have to maintain your hip and knee also in 90 degree, and then your eye
Mm.
level also you have to
Mm.
control with the height of the table. So
Okay.
your wrist, your elbow also must be in a same level with your laptop and keyboard. So
Okay. Okay.
mm,
Okay. So that's when you're sitting down. So how long does it take for the back pain to seep in? Maksudnya macam when you're sitting down, at which point usually will you rasa sakit? So you nak kena bangun, you need to walk around a little bit kan supaya tak lenguh lah.
selalunya kita akan suggest untuk patient if 45 minutes you dah start rasa macam aching pain, pulling pain towards your legs,
Mm.
you have to
Oh, I see.
stand and do some stretching. You don't continue doing the work. Of course the work is
Mm.
important but your health is
Yeah.
more important.
Yalah, yalah.
Okay.
And it's just a short break
Mm.
kan? Okay,
Yes.
all right.
Need
So
a
I
short break.
understand that you've got some slides to show us. Let's take a look at the slide and then maybe we can take it from there. Sebab nanti ada
Okay, sure.
demonstration later in the video lah.
Yes, betul. Got
Okay,
video.
all right. All
Okay.
right. So let's take a look at the first slide. So what is this about?
This one
An
is about
introduction
back
about back pain. Okay, all right.
yeah, introduction of the back pain, which is the first point is leading cause of disability worldwide. And then
Mm,
what I want to mean in this one, leading
mm,
cause this disability of worldwide, because now back pain is the most common cases we saw mostly every day. So
yeah.
when sometime when patient have the back pain, they won't move. They won't move at all because they scared of the pain. Okay.
Mm-mm.
So actually we need to know the spine is the strongest parts of the body. So it
Okay,
is
all right.
around, yes, it's around with the muscle, strong muscle and ligament that designed
Mm,
for movement. So if the
okay.
pain, you scared to move, so
Okay.
the pain won't go off. So you have to move in order to reduce your pain. Okay, so the second one, simple home treatment, which is you can apply cold or hot treatment, which is this
Mm,
one for acute or chronic. If you just fall and then nobody want to take you to hospital, so
yeah.
you don't know how you want to treat the condition. This one, if acute means just happen, so you can apply cold. You can put ice over your back if you where the area of tender. So the cold one, if you already have back pain for 1 2 months, then you can apply hot pack. Okay, and then proper body
Okay.
mechanics. Okay, proper body mechanics, we have to practice this every day, so to prevent your back pain.
Lah, how
Okay,
you sit, how you lift things.
yes, how you live in,
Really?
how
Okay.
you sit, stand, sleep, also you have to do in proper position.
Okay. Sorry, we go back to yang what you mentioned just now, simple home treatment, hot and cold ni.
Yes,
So you're saying that
yeah,
if kita sakit belakang, and
betul.
you're saying that acute means something that happens suddenly.
Betul. Baru je jadi.
Okay.
So contohnya
Okay.
baru jatuh petang tadi, malam tak sempat datang hospital kan. So you letak
Mm.
ais dulu. Sementara
Okay.
nak
So when
tunggu
do you
esok
use the
pagi.
all right, when do you use the hot treatment? Because I think this one pun orang a bit confused kan sometimes dia tak
Confused.
tahu bila nak pakai yang sejuk, bila nak pakai yang panas.
Betul. So macam ni, kalau contoh you dah ada sakit belakang kan untuk sebulan, 2 bulan, itu you boleh letak hot. Sebab benda tu dah lama, sakit tu dah lama. So
Okay.
macam ais, sebab dia
Hmm.
bengkak. Selalunya bila you jatuh, dia ada bengkak. So bengkak you
I see.
letak ais lah, benda sejuk dulu.
Okay, I see. Okay. Alright, got it. So baru
Okay.
kena letak sejuk, dah lama letak air panas.
Ya,
Air panas lah,
betul.
letak panas.
Letak hot pack lah.
Treatment. Okay, jangan letak air panas ni jadi
Hot
baik
treatment.
pula.
Nanti
Okay,
bakar
alright.
lah.
So now let's take a look at symptoms. Okay, because sometimes when we get back pain, kita tak tahu benda tu serious ke tak. When should we see a doctor? Kita tak nak over lah kan. If it's just something that can be treated simply at home by yourself, then we don't have to go see a specialist. So maybe you can explain to us a bit about what are the symptoms of back pain yang perlu treatment.
Okay, yang bila you start ada rasa sakit belakang, tapi contohnya lepas seminggu tu you masih ada rasa benda yang sama. So simptom dia you mungkin akan rasa aching or shooting pain, contohnya dekat belakang. You rasa lenguh-lenguh tak settle. Okay, and then you dah start rasa numbness dekat kaki, kebas.
Oh, okay.
So
dia affect kaki
kebas
juga di belakang ni?
ya, betul, betul. Dia akan efek kaki juga. Sebab kita punya tulang belakang dia banyak saraf-saraf. So in case kalau contohnya sakit belakang dia dah efek you punya saraf, so you akan
Right.
start rasa kebas. Okay?
I
And
see.
then
Okay.
you rasa burning sensation juga. Rasa panas je, burning sensation. And then radiating pain, you rasa mencucuk dekat kaki. Okay,
Okay.
weakness over both legs or one legs. Contohnya bila berdiri you rasa lemah, nak jalan tu rasa macam kaki tak kuat. Okay, itu dah start kena tengok specialist, kena tengok doktor. Okay, limited trunk movement. Contohnya nak bersin pun sometimes rasa sakit, batuk rasa sakit, nak gosok gigi pun rasa sakit. So itu adalah symptoms yang you kena pergi untuk advice lah daripada doktor. So doktor boleh check either you punya macam acute ke ataupun chronic, effect you punya nerve ataupun tidak. So semua tu kita boleh tengok nanti.
Okay, alright. So that's lebih kurang the symptoms lah that some people need to look out for to know how serious it is. Okay, so the next thing, let's take a look at the risk factors. Okay, apa yang kita buat yang akan not the causes, the risk. I think ada risk factors kan?
Ada risk factor.
Okay, alright. So what are the risk factors yang if we are in this particular profile, it makes us more susceptible to getting backache?
Okay, the first one is age. Okay, age 30 to 40 years old. Because usually if you in 20s, you still can bear with the pain. You still can no need to take painkiller. You just do the normal treatment only. But once you enter 30 to 40 years old, because your bone also getting age, right? So degenerative also. So 30 to 40 years old, you will start to have back pain, and then sometimes it will affect you punya nerve, and then due to working also it will contribute factor also. 30 to 40 mostly patient will come around this age.
Alright. Okay. But if you are in your 30s or 40s and you have good posture, you've been taking care of, how you angkat berat and all that. So this would be an exception lah, of course. It depends on how
this one will be an exception. Yes, depends on your how your daily activities.
Okay, alright. Okay, what about lack of exercise? How does that contribute to back pain?
Lack of exercise, as advised, we can do frequent exercise in a week, 2 to 3 times in a week. So what mean by weak or unused muscle? Because you are not doing exercise regularly, so your muscle on your back and your abdominal were getting weak or unused muscle, which is you are not active person, you are not going for jogging, walking and all that, so it will develop unused muscles on your back and abdominal, which is these two, abdominal and back area, is very important for your trunk. Okay, so because
so
the
later
muscle will support.
So later you are going to show us some exercises how to strengthen your back lah, so that we don't get this kind of condition, yeah?
Yes.
Okay, alright.
Yes.
About being overweight ni, extra stress on your back. Okay, how does, can you explain this a little bit?
Okay, as we know, usually we were advised to stay at healthy weight, which is this one to avoid the stress on your back, because if you have extra weight, so your body need to take it and handling it, the extra weight, so it will press down on your back, and then also for your nerves as well. If you sitting, your prolonged sitting working, that one is very very difficult for you to handle it. That's why when you see the doctor also, the doctor will ask you if you have extra weight, doctor will advise you to reduce your weight, because not only your back, it will affect your knee also.
That's true. But what if you are, let's say if you are in your 60s, 70s kan, sometimes macam orang tua, they do have back pain, and sometimes they have put on a lot of weight that compared when they were younger. So at that age memang susah for them to lose weight. How can they handle their back pain? Are there any exercises that they can do regularly, ataupun do they go for treatment, physio? Like in your experience lah, when you see, I'm sure you mesti ada patients yang elderly kan, and maybe ada put on a lot of weight. So apa you punya nasihat dekat patients yang macam ni?
Usually for elderly patient, we were advised to come physio as frequent as as they can, because as you said, they were
Yeah.
having difficulty to reduce the weight. So and then when they come for physio, we will treat the area, and then we will teach simple exercise for the patient, not aggressive exercise, not very active exercise like we taught to the young patient. So for elderly, we still can give them for cycling, and then for 5 to 10 minutes also enough for them. So but they need to come to the physio to get the treatment as frequent as they can, because once the pain reduce, they will feel a bit better.
How often is that? Once a week ke?
Usually
Twice a week? Macam mana?
they can come maximum 3 times a week, alternate day, or minimum twice a week to maintain. Let's say they did already for 6 weeks, the pain getting reduced. So we still ask them to come at least once a week to maintain the pain, because we don't want once they stop, the pain will aggravate more. So that one
Okay.
we want to avoid from this thing happen.
Okay, I understand. But realistically, katalah if you sakit and then you have to go for physio at least three times a week kan. But isn't there any follow up exercises that you can do at home? Because I suppose macam for some people it's quite inconvenient to go to physio 3 kali dalam seminggu, you know, tambah macam orang tua. So will you be able to show us some demonstration later on some exercises that suit the elderly group?
Can can I
Okay,
will I will show you, because the video also the any parts certain um exercises we give to the patient, so at least the patient can do at home also.
follow up kan, yeah, that's right. So
Yeah.
tak adalah macam dia sakit sikit kena pergi physio,
Ah,
sakit because yeah, and then kalau dah tak sakit dia nak pergi physio, sometimes they don't, you know lah, if it's like out of
yeah,
sight out of mind kan, tak sakit dah tak pergi dah
betul.
jumpa specialist. So okay, well that's good. Looking forward to some of the exercises that you will recommend later to
Okay.
follow up at home, yeah. Okay, now let's take a look at the causes of back pain. The reverse pula slide ni. Apa yang menyebabkan back pain? Which one are we talking
Cause
about? This one. We haven't discussed it yet.
yeah.
Okay, apakah
Okay.
sebab-sebab sakit belakang?
Okay, causes of the back pain. The first one is muscle or ligament strains. This one can be because of repeated heavy lifting or sudden awkward position. So this
Okay.
one can result in muscle or ligament strain, which is if you already have poor physical condition,
Yeah.
and then you do constant strain every day on your back, so it can cause painful muscle spasm on your back. So this
Okay.
one is a muscle ligament strain.
All right.
Okay.
What else?
The second one is bulging or rupture disc. We know, right, the disc actually is a cushion between the bones. So the soft material inside the disc, if they bulge or rupture, it can press on the nerve. So this one will affect the the nerve. That's why the patient will have the radiating pain towards the legs, numbness, weakness. So this one bulging or rupture, this is very important. Okay, so because we need to take care of the back, so it won't affect the cushion between the bones. Okay, so the third one is arthritis. Arthritis in the spine can lead to the narrowing of the spinal canal, which is we call as spinal stenosis. Okay, so arthritis on the back also, we have three, which is the osteoarthritis. This one is very familiar because it's inflammation of the joint, which is and then your bones start to green and push each other, so it will affect to your normal daily routine because of the pain. And then we have psoriasis arthritis, which is usually this one happen with people have psoriasis, which is autoimmune disorder. So the third one is very rare, reactive or enterophenic arthritis, which is the reactive because of the infection on the body, which is the enteropathic. This one affect your bowel and bladder. Okay, so osteoporosis, this one normally we know because this one develop painful fracture due to your bone become brittle or porous. So selalunya this one berkaitan dengan tulang,
Okay.
osteoporosis and arthritis.
Okay. Out of all these causes that you mentioned just now, ada tak yang mana yang boleh improve kalau kita buat physio?
Usually all can improve, but it will takes time. Usually muscle and ligament strain, this one a very fast recovery because the once the muscle and ligament getting relaxed, and this one your pain would not so severe. But bulging and rupture disc, this one it takes time, same as arthritis and osteoporosis.
Yeah. Because
This one will take
osteoporosis
time.
dengan arthritis ni something that you get and it's ongoing kan. So basically
Yeah,
nak
this
kena
one
manage,
betul.
kan, nak kena like manage it on a long term basis lah, as opposed to muscle ligament strain ni once dah baik betul okay lah. InsyaAllah.
Okay dah, tak
Kan?
ada masalah.
Tak ada masalah. But macam bulging, ruptured disc ni, this sounds quite serious. So I suppose
Severe.
yeah, it's more severe. Okay. Okay. Alright. So at least we know what physio can do. Okay. Now let's take a look at when should we see a doctor?
Okay, when to see a doctor? When you have pain for past few weeks. Let's say when you start to have pain, you don't want straight go to the doctor. You want to see whether 2-3 days it will resolve, right? So
Yeah.
this one we will advise you to see doctor if your pain is not resolved. Let's say few weeks, 2 weeks also the pain same only. Okay. So after fall or injury also, usually we will advise to see doctor because sometimes you won't feel the pain on that time. Sometimes you after 1 week you get the pain. Okay, so these two is very important for you to see doctor because if you want to wait until you feel pain spread down on your legs, this one is
Yeah.
very getting severe already. So at least
Yeah.
when you saw a doctor or physiotherapist, you see in a acute condition, you won't straight away go up to chronic condition. So at least we can control, we can advise you what you can do, what you cannot do, what exercise, and then what the proper posture you can sit, you can stand, you can sleep. Okay, so if you come when you have pain spread down on your legs or weakness, numbness over your legs, that one is very chronic already, very severe. If you have bowel and bladder problem also, this one, not to say we cannot have, but it takes time. You can we can say to the patient, no, within 2 weeks you are okay already, because this 3 point is very severe to the patient. Okay.
Okay, let's just summarize that again. So kalau if it is a pain that is ongoing for a few weeks, so you should see a doctor, don't wait, yeah? And if you fall again, maybe the pain, it might not be painful then, but it may be painful later on, also see a doctor. But if you have pain spreading towards your legs and bowel and bladder, never knew, back pain actually ada some connection with bowel and bladder problem.
Yes.
Okay, and then also numbness. So these are the situations where it is serious and urgent for you to see a doctor. Betul?
Yes.
Okay. All right. Now, why don't you share with us, in your expert view, how to care for our back, how to strengthen the back?
how to care for your back, first you have to stay at healthy weight so it won't put more stress on your spine, on your back. Okay, so the second one, exercise. Let's say you're not interested to do jogging, run, so you can do swimming, brisk walk, just
Cardio lah. These are cardio
yeah,
exercises. Okay.
cardio exercises. And then you
Mm.
can do also static cycling also can
Yeah.
for exercises. And then practice safe lifting methods. This
Okay.
one, practice safe lifting methods is not on our during working only, but sometimes when we at home, we want to carry child, we want to
Yeah, that's
pull.
right.
Sometimes we just turn. Okay, so this one
Yeah. Yeah.
we need to avoid the twisted movement. Okay,
Okay.
so
Yeah.
practice good posture. This one during sitting, standing,
Mm.
sleeping. This one we need to practice a good posture. And then the last one, wear quality shoes, which is have a good arch support. So to prevent your back pain.
Can you describe these quality shoes with good arch support tu macam what do you mean?
This one contohnya tapak dia kan tak
Mm.
terlampau nipis and then tak terlampau keras. So you kena
Okay.
betul-betul masa beli kasut tu you kena rasa selesa. Contohnya ada certain kasut yang ada cushion kan. So dia
Yeah.
rasa selesa. So this one is mean good arch support. Because kalau you beli flat shoe yang keras, mula-mula you takkan rasa sakit belakang tu.
Yeah.
Tapi
Right.
and then start slowly you will have the back pain.
Yep. Yep. Right. Okay. Some examples about practicing. Okay. Here we go. Baru nak tanya tadi. Ergonomics. What does it mean? What does ergonomics mean?
Proper technique, proper body mechanics.
Okay. Alright.
Okay, so proper body mechanics macam I cakap lah tadi, masa you duduk kita kena practice proper technique in sitting.
Yeah.
Let's say the first one is very bad posture during sitting, which is most of us did the first one. Okay,
Yeah.
so
Sebab tu
so the
tiba-tiba I dah macam adjust my chair already.
okay, so the second one, macam I cakap tadi lah, dekat belakang you letak back support and then you
Okay.
punya hip dengan knee 90 degree ataupun contohnya kaki tak sampai kan dekat lantai, you letak stool kecil ataupun kotak lah. So you punya kaki tak tergantung. Itu sebab kita tak nak ada nerve compression dekat you punya kaki. Okay.
But some people they like to put a stool macam like small
Yes.
bangku kan underneath their office desk so that they can rest their feet on it.
Yes.
Is that okay?
Because
That means it's
yes.
not like 90 degrees, dia macam 45 degrees.
But that one is very good because it reduce the nerve compression on your thighs. Okay.
Alright.
So and then see the hand also in 90 degree. So it won't affect your neck also. Okay. And then the second one is the lifting methods. Okay. This one also, the first one, most of us did the wrong one because we want to fast doing work and all that.
Correct. Yes.
But you have to practice the good one. You have to bend down, get your knee in bending position, bring the things near to you and then slowly go up. Make sure your back in straight position.
Okay.
Okay.
Next.
This one same as the previous one, the lifting techniques. So the fourth one, this one like I said, when you carry things, don't do twisted movements. The first one is very wrong because once he take from the other side, he just turn twisted. So
I see.
Yes. So you have to do, you take and then you take time, then only you put the things on the tables. You don't twist because it will affect your back.
But these twisted movements you're talking about only if you are holding something heavy lah, because like sometimes when doing exercises, warm-ups, cool downs, part of the routine is also for you to twist.
But this one, if you carry heavy things,
Okay.
because the things will give pressure to your back. If you're
I
doing
see.
exercise, you are free. You are
Yeah,
nothing.
correct.
You just
Yes.
your body also in relaxed position. But this one,
Mm,
because your back intense, you want to
yeah,
carry things, right? Heavy things.
correct. Yeah.
Okay.
Okay, all right. I think we have arrived. Belum ada lagi. Okay, let's talk about this first. Oh, this is about
Okay.
standing and lying down. Interesting.
Yes, standing and lying down. So standing, you have to stand straight. Don't
Mm,
like the second one. Don't stand with a stoop posture, which is like
mm,
membongkok. So you have
yeah,
to stand straight. Okay. So
yep.
sleeping position. If you lying down on the side, you have
Mm.
to put pillow between your knees, between your
Oh, I
legs.
see. Okay.
If you lying down facing upwards, you put
Mm.
pillow over your legs, over your knees.
This is
Below
affecting
the
your
knee.
back.
Yes, this one will
Oh,
affect
I
your
see.
back.
I see. Okay. All right. Okay, I've got a quick question about this. You see, sometimes when somebody is so used to standing, at a different posture, suka bongkok, ataupun dia tak perasan, dia suka tak suka, but dia dah macam, it's like already
Terbiasa.
part, dah kebiasaan. Maybe memang kebiasaan dia duduk like this, slouching, atau kebiasaan dia diri pun macam, like the shoulders down
Hmm.
semua. And then when we hear of what we need to do in order to care for our back, okay, better posture. But only when
Yes,
somebody
betul
comes out to
posture.
you, why are you slouching? You need to straighten your back, and then baru dia buat. But kalau tidak, he or she will always fall back sebab dah menjadi satu kebiasaan kan. So what's your
Betul.
advice for people who face this kind of habit lah?
Usually this habit,
Mm.
only you can change the posture. Okay,
Mm.
because sometimes kalau of course you akan rasa sakit tu dah start rasa sikit-sikit. So you kena
Mm.
take initiative untuk sentiasa remind you punya body untuk buat posture yang betul. Okay,
Mm. Yeah. Yeah.
because physiotherapy sometimes you only with the physio session 45 minutes to 1 hour.
Yeah.
So
Correct. Mm.
most of the time you are doing work, your own work in the
Yep.
house. So
Yep.
this one usually we will advise patient, we will
Mm.
tell them you are the one need to discipline yourself. Okay,
Mm.
because no one can force you, but only you can change your posture, your habits.
Yeah lah. Okay. Because sometimes ada juga yang macam rasa that if they start standing up straight, that's uncomfortable because they are so
Yes.
used to not standing up straight kan.
Mm.
So
Yeah,
maybe they just need
betul.
to put post-its everywhere,
Ah,
posture, some reminders.
that's
Okay, now
why.
let's take a look at some back stretching exercises.
Mhm.
This is a video. Okay, jom.
Yes, this one the video, which
Mm.
is the first one is child pose. First
Mm.
you kneel on your knees and the
Alright.
toes, then stretch your shoulder like in the video. So
Mm-mm.
stretch as far as you can, then you
Yeah.
relax, you hold. You
Ni
hold for
yoga
10
ni.
seconds. It seems like yoga, but this one for
Mm-mm.
stretch, to stretch your back. Because
Alright.
sometimes you feel very tight on your back. So you
Mm.
stretch, you wait until 10 seconds, and then you
Mm-mm.
can relax. You can relax, and then you can repeat 5 repetitions, 10 repetitions,
Okay.
depends on you.
Yeah, I like that position is very relaxing. Kalau kelas
Yeah,
yoga, participants memang tunggulah child's pose ni because it's like so relaxing. Nice stretch.
yes. Because your muscle all on your back, after that you feel relaxed.
Wonder. Okay, what's this then?
This one, double knee to chest.
Hmm.
So usually we will ask patient to lie down, bend the
Mm-hmm.
knees, both knees, and then the hands hold the knees, bring forward, bring towards the chest. So
Alright.
you will feel stretch on the back.
Mm.
So you feel stretch on the back. You hold for 10 seconds, then you can relax, let go.
As close as possible, macam you
Yes,
rakap kat kuat.
betul.
Okay, alright.
Okay, this one we call as piriformis stretch. First, take the affected leg. So you put on the on the unaffected legs. Then same like double knee to the chest. You pull the knee towards your chest. So this one you will feel stretch on the affected leg because we want to stretch the muscle, piriformis
Okay.
muscle.
But if it's not your leg that's giving you the pain, it's actually your back. This is still something
Yes.
that you need to do
Yeah.
lah. Okay.
Actually, the pain from your back. So it will
I
affect
see.
your
All right.
muscle, your nerve towards the leg.
Yeah, of course, it's all interconnected. All right.
Yeah.
So how many times to do this?
This one, usually we will ask patient to do first with 5 repetitions. Then if
Mm-hmm.
no pain, they feel comfort, they will, we can increase to 10 repetitions. This one we
Per
slowly,
day.
slowly increase. Yes. They
Okay.
can do once a day or twice a day.
All right. So kira 5 or 10 ni, that is one set lah.
Yes,
So
one
you can
set.
do one set a day or 2 sets a day.
Ya, betul.
Okay. All right. Next.
This one is we call as cat and camel stretch, which is first when you inhale, you lift up your lower rib cage.
Yeah.
So you will, they can be round your back and relax your neck. So
Yeah.
you hold for 10 seconds in that position.
All
Then
right.
you when you exhale, you just relax. You just maintain firm the abdominal and then relax like in the video.
All right.
This one also very good for stretching,
Mm.
the back
So this
stretch.
one yoga pun ada. It's, but they call it cat and cow pose.
Yes, it's the same.
Macam kucing kalau marah kan, dia punya back to the arch kan.
Betul.
Okay, so we've come to hamstring stretch. What's this all about?
Yes, hamstring stretch. This one, we to relax the hamstring muscle. So
Mm.
you put either at home if you don't have the TheraPen, right, like in
Mm.
physio department,
Mm-mm.
so you can do towel at home.
Yeah.
You put towel on your feet and then you stretch. You pull the towel. So you feel
Okay.
stretch on your thighs.
Can you do this when you are lying down?
Can also.
Same movements lah. It's just that you're lying
Yeah.
down.
Yeah,
All right.
same movement, but easy to do in sitting.
I see. I see. Do you lock your knees when you do this? Means your kaki
This
is very,
one,
very straight?
yes, either straight or slightly bent. Not too bent, but slightly.
All right. What's this?
This one we call as calf stretch or calf raise, which is when you stand, you can hold table or chair, and then you slowly raise your heel. Okay,
Yeah.
like in the video, see, slowly raise the heel, and then you hold for 10 seconds, and then just relax.
All right. Okay. Clear.
Okay.
Nice. That's all?
Yes.
Oh, okay.
This one back strengthening exercise.
Oh, yang
Just
tadi
now
tu?
back stretching.
Oh, I see. Okay, okay. Right. All right.
Okay, so move to back strengthening exercise. We can call the pelvic bridging.
Okay.
We will
Jom,
ask the
sorry.
patient
So
to
back strengthening ni, whether you have a bad back or not, is good for you to do.
yes, can,
Okay.
because it strengthens the muscle.
Yeah, yeah, yeah. Okay.
So the pelvic bridging, we will ask the patient to lie down, bend both knees, and then try
Okay.
to flatten your stomach. Means you tuck in your stomach and then lift up your buttock.
All right.
So lift up your buttock, hold for 10 seconds, and then relax.
For 5 times also?
Yeah, 5 times or 10 times.
All right.
Okay, this one we move to pelvic tilts. Pelvic tilts, which is same position as pelvic bridging, but you just rock your pelvic bone up and down. See in the video, it moves up and down.
Okay. So just lift your buttocks up and down, yeah? Okay, all right, I think that's clear already.
Your pelvic bone.
Okay. Oh, Superman pose.
Okay,
This is
one
very
we call,
relaxing.
this one we call Superman pose. You just lie down, facing down, and then just extend all your limbs, which is your both hands and both legs.
Yeah.
This one to
Very good stretch ni, because you can feel your whole body, all your limbs kind of
Yeah.
stretching. Very nice.
betul, sangat bagus.
Yeah. Okay.
Okay.
Wow, ada advanced Superman pose.
This one we call as advanced Superman pose, which is in a crawl position, baby crawl
Ni bird
position.
dog. Yeah.
Yes.
I think some call this bird dog.
Some call bird dog. So let's say you lift up left hand, the leg you lift up the opposite one, the right leg. Like in the video, so you hold for 10 seconds or so, and relax.
Okay, all right. So that was the presentation by Miss Nurul Ain. Okay, Miss Ain, we've got a few questions now from our audience. Let's take one question from Miss SP Yan. Hi, Miss. I experienced before. I did not fall, but after woke up in the morning, I have very bad back pain. They cannot walk. Oh, sakit ni. What causes this to happen, and what is the immediate action needed to take in order to reduce the pain?
Okay. Sometimes this one also we experienced before. Patient said didn't fall.
Exactly.
Patient didn't fall, but sometimes maybe because of your bad posture during sleeping or during working. So if you cannot walk, usually we will if patient we will teach the bed mobility technique, which is from your lying down flat, you have to turn to one side first, get your both legs down, and then only you get up. Because if you from flat, you want to get up straight, you will very painful. So we will teach step by step from flat to side lying, and then to sit, then only you get up from the bed.
All right. And what about the immediate action that needs to be taken in order to reduce the pain? It means you dah rasa sakit, but before you get to go and see a doctor.
Okay. Maybe if the area of pain you feel swelling or tender, because this one is just happen. Maybe you can put ice also. But some people they don't like to put ice. They like to do the hot treatment. So you can put the hot treatment also to relax your muscle. Once your muscle getting relaxed, then it will easier for you to get up from the bed.
I see. So if you rasa pain ni macam yang about this question tadi, you can relieve the pain by using either hot or cold pack.
Yes.
Okay. All right. Okay, let's take a look at the next question. This is from Miss Harunisa. Is going to the chiropractor. Okay, what do you think? But maybe this is something else, kan? Maybe it's perhaps we would skip this question. Okay, I think because chiropractor, we just focus on physio lah. Physio lah right now kan. Maybe it's quite controversial ke apa kan. Okay, chiropractic. All right, next by Miss Evelyn. Hi, will we get a certificate for joining this session? No, but that would be nice. It's okay. But by virtue of you viewing this is good already. Thank you so much for being with us. Hope you find this educational. Okay, there is one by Miss Fanny Lim. Does it help with the core muscle strength? Oh, I think this is regarding the exercises that you showed just now. Does this help with core muscle strength?
Yes, it helps the core muscle. If you doing the back strengthening exercise properly, it will help your core muscles.
Yeah, yeah. Okay, that's good. And one from Miss. Tu je, tak ada lagi. Okay, all right. Actually, I thought there was a question about. Okay, no worries. My eyes. Thank you so much. So that was our session today, ladies and gentlemen, by Miss Nurul Nabilah, who is a physiotherapist from Columbia Asia Hospital, Tebrau. Thank you for your expertise, for your tips and advice. Inshallah, we'll see you again. Okay, thanks everyone. See you in the
Okay.
next episode of Dr. Scholar.
Okay, thank
Bye.
you.
Thank you.